Hi, my name's Philip McGee, and I am a physical therapist that's board certified in geriatrics. And in 2021, I decided that I was leaving clinical physical therapy and pursuing a non-clinical career. I wanted to talk today about that process and what were the reasons why I decided to leave clinical physical therapy. Before I get started in the reasons why I chose to leave clinical physical therapy, I wanted to make a few things clear. First, I love my career of being a physical therapist. I think physical therapy is one of the most rewarding careers out there. So this video isn't to talk about how horrible physical therapy is as a career, because I don't believe that that is the case. I mostly wanted to talk about the different reasons why I ended up choosing to go the non-clinical route. A physical therapist who graduated in 2006, and I started out my career in acute care. I spent a little bit of time doing travel therapy and worked at a skilled nursing facility and also worked in acute care. And then the last 7 years of my clinical career, I was doing home health. And in 2020, there were a lot of different things that happened. The first part of 2020 that was a big event as far as home health was PDGM. And if you're not familiar with PDGM, it stands for the patient-driven groupings model. And essentially what it was saying is that the number of visits that are performed by physical therapy, that wasn't going to be the factor that was going to play into how much reimbursement was going to happen. So for a lot of home health agencies, that meant that there was going to be a reduction in the amount of revenue. And a lot of home health agencies were talking about strategies on how to reduce the number of physical therapy or occupational therapy or speech therapy visits. And so you had the PDGM, and then, of course, all of us are aware that the coronavirus pandemic, that happened. And so when you combined that with the geriatric population, which was a higher risk population, you had a lot of cancellations, a lot of more patients that didn't want to be seen, or that they were hesitant about being seen. And so what ended up happening was that you combine PDGM, which said to reduce the number of therapy visits, and then you had the pandemic, which made those that were going to get therapy already fearful of having someone who is a healthcare practitioner coming in unless it was absolutely necessary. And that ended up leading to a lower census for us in the company that I was working for. And then also nationwide, there were lots of therapists that I was seeing comments about how they were going to have a reduction in pay. And a lot of them, especially with the larger home health agencies, they were going to get a 20% pay cut. And so I felt pretty grateful that for the majority of 2020, that my income wasn't going to change dramatically. And I was very fortunate that I wasn't furloughed and that I had a full-time job. What ended up happening at the company that I was working for was that at the end of 2020, there was an announcement that there wasn't going to be a reduction in pay, but instead that the productivity expectations were going to be modified. Home health goes by a certain number of points, and each visit that you have has a different value of points. What they ended up doing was keeping the same value of points that needed to be performed in a certain week. In this case, it was 30 points. And then what they did was they reduced the value of some of the visits that used to have a certain weight to it. Say, for instance, an evaluation that was worth 1.5 points. Now that was reduced to 1.25 points, which at first it sounds like that's not very much, but if you end up having 4 evaluations, then you've missed out on a full point based on the previous model. And I started to see that that just wasn't going to be very sustainable long term to be able to keep that same productivity. Along with the change in productivity expectations, there was a decrease in the number of patients that we were getting because the census was decreasing. And I had made those concerns known to the company that it seemed like we weren't getting an increase in our census. And so it was getting really difficult to meet the productivity expectations. And then in order to maintain my full-time status, they were wanting me to work on the weekend to make up for the visits that weren't available during the weekday. When you combine all of that, I ended up having less of a work-life balance that I wanted because I didn't know if I was going to be working over the weekend, and I also spent a lot of my time at home either trying to finish my documentation from an evaluation that I had or a start of care, and then my children, they were wanting to play, and a lot of times my mind was thinking about work-related things, and I was finding that that also didn't seem sustainable, that I didn't want to have to spend every day thinking about work. I wanted to be able to shut that part of my brain off once work was over. And I do know that there are therapists that are very good at what they do, and they're also able to have a good work-life balance, but I just know for myself that was something that didn't seem like a possibility. The last part I wanted to talk about today involves Medicare. And so I mentioned in the beginning that I'm a board-certified geriatric physical therapist, and so the majority, if not 99% of the people that I work with, they are Medicare beneficiaries. And it has seemed like there's this ongoing battle with reimbursement and Medicare, and it seems to happen every year. If it isn't every year, it's every few years, and that didn't seem very appealing to have to depend on my source of income as whatever Medicare reimbursed. And there was a Facebook group that I joined that talked about becoming a Medicare therapist, and it seemed like there were a lot of hoops that needed to be jumped through in order to get to that point. And like I said, if the majority of the reimbursement that I was going to get came from Medicare, then I didn't want to risk having to have a claim that was denied or to have to resubmit different things. It just didn't sound very appealing. So the option of trying to go out on my own or to try to seek a different avenue of geriatric physical therapy, that just didn't seem like something that I wanted to deal with. Today I've talked about a few of the reasons why I decided to leave clinical physical therapy, the productivity expectations, the decrease in census for the company that I was working for, the poor work-life balance, and then the Medicare reimbursement issues. And I do have other reasons why, and I'll discuss those in future videos. But for today, I just wanted to start out with a few of the reasons why I decided to go non-clinical. And if you're someone who is interested in going in a non-clinical career, I have created a website and Facebook group called Nonclinical Career Guide. And in that group and in the website, I provide resources. I do have a free ebook that you can sign up for, and it goes over the common errors that I see when it comes to writing a non-clinical resume. I also do one-on-one interview prep and also one-on-one resume reviews, and I'll leave the link below so that you can sign up for one of those. And if this video was useful to you or you enjoyed the content, please feel free to leave a comment about what you would like in a future video, and please hit like and subscribe to the channel. And thank you so much, and I hope to see you in the next video. Thanks.